Welcome to the Eat Away Kidney Stones podcast. I'm your host, registered dietitian and kidney stone expert, Melanie. After learning a ton about kidney stones and helping people prevent stones at the University of Chicago, I was fed up with all the terrible advice people were finding online. So I decided to do something about it. The Kidney Dietitian was born. This podcast is for people who want to learn what actually works to prevent kidney stones and still enjoy life, eating, and their favorite foods. Let's dive in. Hello and welcome to the 73rd episode of the Eat Away Kidney Stones podcast. I'm your host, registered dietitian and kidney stone expert, Melanie, and I am thrilled to have a very, very special guest on the podcast today. It's a fellow dietitian. Her name is Vanessa Connolly, and it is so fun to actually meet you in, quote, real life, Vanessa. I feel like we've been Instagram friends for a while, but never have actually talked, which is kind of so strange. But Thank you so much for being on the podcast today.
Thanks so much for having me. I'm super, super, super excited. Like I was fangirling when you reached out about being on your podcast, and I was like, oh my God, for sure.
Yes. And this is a topic I was saying before we started recording that is something that is very important to me, but something that I haven't really talked a lot about. So thank you so much for having this sometimes difficult discussion on the podcast.
Sure.
And yeah, you had given this talk for a group of dietitians. I can't remember. And someone in my network was like, oh, this amazing dietitian just gave this talk, Vanessa Connolly. I was like, she should totally be on the podcast. So yeah, so thank you for being here.
Yeah, of course. Thank you. I appreciate it.
Yeah. So Vanessa, can you tell us a little bit about who you are and what you do? Just tell us about the life of Vanessa.
Yes. So I am a seasoned registered dietitian nutritionist who is specializing in kidney nutrition. So I have been a dietitian for 20 years. I have mainly just been in CKD. I started off as a dialysis dietitian and quickly learned that the information that I was taught to help my clients were not really being very helpful. So learning how to focus more on preventative CKD care, which is why I got out of dialysis and started my own private practice to help with slowing down the spread of CKD with the right tools and supports versus telling people to restrict. So that's me in a nutshell. But behind being a dietitian, I live right outside Charleston, South Carolina. I am a Maryland native, so crab cakes and football baby. But outside of that, I'm a mom to two kids. I'm married to my best friend, and I am just overly, overly, overly obsessed with helping you improve CKD one bite at a time.
So as the title of the episode suggests, we are going to attempt to cover a very complicated topic of healthcare disparity, which is like such a broad umbrella term. So can you kind of define it, for listeners maybe haven't heard that term before, like completely unfamiliar with this topic, kind of what is healthcare disparity, would you say?
Yeah, no worries. So I'm just going to read a definition. So it's defined as an unequal burden of disease and healthcare access across different populations. So health disparities can definitely be influenced by socioeconomic status, by race, ethnicity, and location. So there's definitely a higher prevalence and worse outcomes in minority populations.
Mm-hmm. Okay, excellent. And can you share some data about how this is different? Like how this really manifests? You say okay, so health outcomes are worse, but what does that mean and how much worse are they?
Yeah, so there's a lot of research and studies out there and just I kind of gather a lot of my information from. So typically African Americans are four times more likely to develop kidney failure than white counterparts, and Hispanics are one time more likely to develop kidney failure than white counterparts. And I think there's a lot of contributing factors at play, right? So we know that there's higher rates of diabetes and hypertension among people of color, and diabetes and hypertension, are the number one and two underlying causes of CKD.
Mm-hmm.
So this kind of population, socioeconomic factors definitely affect access to healthcare, and the quality of like CKD care. And I think because of that, it can definitely cause more progression of CKD. More folks are ending up on dialysis. More folks are ending up in kidney failure a lot sooner than expected. But yeah, there's so many things like access to resources, to receiving that high quality healthcare. Some folks have lack of transportation. So either, they don't have an adequate car, they don't have enough money to put gas in the car to go places, or they're living in an area where there's not quick access to actual specialized care, nephrology care. And then there are like systemic barriers, like housing, lack of education, lack of employment, or, if employed, maybe there is a lack of health care or
Mhm.
not being able to afford health insurance, I'm sorry, to be able to go get that care.
Oh my gosh, I have so many things written down to follow up on. So, okay. So, I want to highlight a stat that you threw out. So, African Americans are 4 times more likely to progress to end stage renal disease. So, the need for dialysis or a transplant. Correct me if I'm wrong. I'm pretty sure that the incidence of early stage CKD is pretty standard or pretty much the same across different races. Is that correct?
Correct. Yes,
But the
correct.
difference seems to be with that progression of disease, which is fascinating. And you did a great job of kind of outlining some of the like, we could talk for 18 hours about just why that is. Um, but you said specifically access to healthcare and quality of healthcare. So, how does race impact access to healthcare? Let's dive into that specifically.
Yeah. So, just speaking, so I live right outside Charleston, South Carolina. So, it's a very booming community. A lot of people are moving here, but there
I've
are
never been. I've
also,
heard great things.
oh, really?
Yeah.
Oh gosh, you should
I would
come
love
visit.
to. I would love to come. Yeah.
But there are very big pockets of areas, in particular, like downtown or in like other outlining areas where, there are just lack of resources, lack of grocery stores, lack of like healthcare facilities.
Mhm.
And so it just in these kind of populations, kind of run down minority driven populations. And so I think because of that, can definitely cause more of a gap with getting early access or continued ongoing access for CKD care.
Mhm.
And also, I think just that housing in general, some of those facilities that are like low income housing may not really be around areas where somebody could potentially just get on a bus and then go to their healthcare building, or maybe live in a rural area where they don't have transportation or the bus doesn't come out that far, or they're
Mhm.
having to rely on a family member that works every day. And so they can only maybe go to the grocery store like once every 2 weeks or go to an
Mhm.
appointment, when they can. And so sometimes you have like canceled appointments.
Mhm.
And it's not always because like I don't want to see my doctor today. It could just be because I don't
Literally
have
can't get
access
there.
they can't get there.
Mhm.
Yeah, they
Yeah.
truly cannot get there.
Yeah. I do just put a slight positive spin on COVID and what's going on. I am excited about the virtual healthcare and like how virtual visits have stuck around post COVID. I think
Mhm.
that is one really, really good thing that has come out of it, that potentially can begin to reduce that barrier of distance. Obviously, there are massive issues with maybe having access to internet and a computer and these types of things, but it is at least an option for many people.
Yeah. Oh, most definitely. And I think that was one of the things that I definitely wanted to stress as far as like helping with policy or helping gain better access is using that telehealth
Hmm.
option, especially for like nutrition care, and
Hmm.
outside of just like doctor care as well. And so I think, I am fortunate to live in an area where it's very, population friendly to have that kind of access where, there might be other facilities or other towns that don't, but
Yeah.
I think the prevalence, like, and I agree, since COVID, like that was one thing that really stuck around that has been super, super helpful is
Hmm.
that access to telehealth care.
Yeah. Yeah. Especially to your point, like, access to highly specialized people such as you and myself, right? Like finding
Mhm.
kidney dietitians is really tough because there's not enough of us. And
Mhm.
so if you add that barrier of like, oh, I've got one, but she's, 5 hours away, it's obviously not going to work. But working with people virtually is such a great option, especially for nutrition when we can do pretty much everything we would in person via the
Absolutely.
computer. Yeah.
Absolutely.
One
Definitely.
one rebuttal
Yeah,
or
yeah.
you know things I've heard people say about the access to healthcare and how people who are live far away from say big hospitals, um like how is that different? Because it seems as though, so okay, let me back up. So I live in, or I grew up in rural Michigan, so like middle of nowhere, very small town. And I um people will say like, oh well, we have just the same disparities because we don't live in a big city, we don't have the access. um but it's all white Caucasian people, right? So how is that different? Like how can you kind of talk about the intersection of it's not just simply like access, but how race specifically kind of plays into all of this?
Good question. And I was going to say, like it, and I definitely want to preface and say it's not just the minority population, because you're right, it does go across the board with Caucasian populations as well, even in those rural areas. But I
Mhm.
also think within those rural areas, I feel like some of those, some Caucasian populations may not have a whole lot of other underlying complications that minorities might experience, and they might have better access to like the internet or to having resources in the home versus those that don't. Now, again, I definitely want to stress that yes, you have white people that are in that same boat where they don't have access
Yeah.
and they don't have transportation and so on and so forth. But I do find that like genetics can definitely play a part in um, like worsening outcomes. Um, but
Yeah.
yeah, that
It's like
is,
there's definitely poor white people. No doubt about it, right?
yeah.
But a poor white person doesn't also have the barriers that a poor black person would have,
Mhm.
right? In
Right,
terms of the housing and
right.
facing systemic racism in finding a job and literally all steps of life from the moment you're born, quite frankly. So, yeah.
Yeah, yeah. And I do find also that some minorities they do experience racism. They do experience healthcare bias. And I feel like that can definitely shun somebody from wanting to continue to follow up with a healthcare provider,
Mhm.
or it does develop some sort of like mistrust
Mhm.
because they don't feel heard, or they feel dismissed, or they don't feel understood. And
Mhm.
again, not saying that it's just simply, minorities, because white people do experience the same, and I
Mhm.
work with clients of all various races, and a
Mhm.
lot of times they do complain that they don't feel understood, or they feel dismissed by
Mhm.
their healthcare team.
Yeah. And I want to say that there's actual data to back this up, right? So I know,
Mhm.
and the one thing that pops in my head in particular is that the pain levels of Black women specifically, I believe, are rated as less by their healthcare providers compared to white women. I think in the
Yes,
context of childbirth, I think, or maybe it's
yes,
pain in
I think
general.
so. I think you're right with
Yeah.
childbirth.
Yeah, but there's actual data to show that doctors treat people differently based on the bodies that they're in, whether it's their race or another big thing that is a massive issue in healthcare is weight bias.
Oh,
If you live in a
yes,
larger body, you are almost guaranteed, I would say, to experience discrimination. And you go
absolutely.
in for a cold and they say, well, you just got to lose weight. Like that's going to do literally
Right.
nothing, right?
Right.
Like, and so there's so many different aspects, and all of these things play together, right? Because minorities are also more likely to be in larger bodies, and so that you've got two sort of things that you kind of have to overcome to find a doctor that you feel comfortable with, that you have access to, that is going to take you seriously.
Absolutely. I mean, I can speak for myself as an educated Black woman with some medical background and
Hmm.
like, you know, a lot of nutrition expertise going to a physician for follow-up and care and feeling like I've been dismissed.
Hmm.
And a lot of times, like I definitely advocate, I'm going to stay pesky. I'm going to ask questions. I'm going to utilize my 15, 20 minutes of time to really like get the most out of this visit, but I feel like I always have to like prove my worth. Like I
Hmm.
am educated. I know what you're talking about. You're not going to sit there and tell me like, I don't have blood pressure issues, but for example, high cholesterol. I have high cholesterol. It runs in my family. It's something that I deal with and keep up with all the time. And then, yeah, there's times where my LDL is elevated, right? And I have genetic components because of that. But to have somebody just look at it and say, don't eat too much fat and then walk out the door, ma'am.
Right.
No, we're
You
not
have
having that
no idea
conversation.
what I eat. Like,
And I'm a dietitian, right? Or
right.
I'll say that I'm a dietitian. Oh, well, you know what you're doing, and then they get up and
Hmm.
leave. And I'm like, okay.
Yeah. Yeah. And it's insane to think that you feel that you have to do that, right?
Mhm.
Like, I think I've thought a lot. I've used the healthcare system quite a bit the last 4 years, going through some fertility treatments and then having
Yeah.
twins. So, having twins and then managing sickness with the twins, and then, all the follow-up that I've had to go through myself, right? Just a lot more access to the healthcare system than I have had previously in my life.
Um,
And I think every single time that I am trying to schedule an appointment or I'm trying to figure out how to get labs done, it's like I am an educated healthcare professional and I am in tears trying to figure this out, right? Like, and I'm
mhm.
also, even though I've dealt with a lot of doctor's visits the last 4 years or so, not nearly as many as someone with, say, chronic kidney disease who is also managing
Right.
hypertension and diabetes and, maybe a cancer history and
Mhm.
whatever else, right? Like, that is so many appointments.
Mhm.
And our healthcare system makes it, quite frankly, impossible for someone with limited resources who maybe can't be sitting around waiting for the nurse to call them back to schedule that appointment because that's the
Right.
only way that it can happen. Or you have to sit on hold for an hour, or, they
Yeah.
ask you all these questions and you're like, I literally don't know. And like, there's so many issues with
Mhm.
just simply getting in to see the doctor. It's so easy, I feel like, for people to say, oh, well, people just like, why can't they just like get to the doctor? Why can't they just make an appointment? Because it is really, really hard. Not to mention the like transportation and like geographic issues that you brought up
Yeah.
earlier.
Yeah. And then you hit the nail on the head. Like a lot of these, like at least big cities, and I'm just speaking because I live in Charleston. I grew up in Maryland and like suburbia, but so the healthcare system wasn't as like ornate as it is down here.
Hmm.
But when you have like big medical facilities, I mean, it's a complex system. It's not like you pick up the phone and call and then you go directly to one person. They will transfer you to somebody else. They don't
And
know
then
what they're
someone
talking
else.
about, and then they transfer you to somebody else. And it's
Yep.
so it's frustrating, And
Hmm.
so, like you said, when you're dealing with like DKD on top of like diabetes or blood pressure or heart disease or whatever else, and then maybe you have in like, lack of education and just lack of understanding on top of that, yeah, it's going to really put a lot of strain and stress on somebody,
Hmm.
having to just navigate like, where do I go? Who do I need to talk to when I'm trying to like figure out something going on with my care?
Hmm. Yeah. Right. And that's just getting to the doctor, not to mention all those issues about actually seeing the doctor that we just scraped the surface on,
Right.
right? Yeah, it's when you actually think about like the steps that need to happen for someone to have good outcomes from a health perspective, right? Like they need to understand that health is important and that what you do matters and that seeing your doctor matters. You need to have the financial resources to go see the
Mhm.
doctor. You have to have the time and education to make that appointment and get to the appointment. And then you also then have to follow up with potentially like 18 different teams, right?
Mhm.
Like it when you start thinking about all of the barriers that certain populations face and how difficult it is to really stay on top of your health in this country. Um, duh. Of course
Yeah,
there's differences.
absolutely.
Yeah.
Absolutely. And so like my heart really does go out to that CKD population because like when I started, and I'm a seasoned dietitian. So when I started dialysis, I mean, when I started being a dietitian, I was a dialysis dietitian for a long time, and so my heart really, I grew a lot of empathy for folks with CKD because it is so complex
Mhm.
and they are dealing with so much stuff and then having to like, life is lifing on top of chronic disease and chronic illnesses over and over on, stacked on them. It's hard. And so, giving grace and having empathy, I think does go out the window a lot. And so I think
Mhm.
just people in general just need to be a little bit more empathetic and just have more understanding that it's just really hard for some people just to navigate their way.
Yeah. Yeah. It's hard for anyone. Again, as an educated healthcare professional, I,
Yes.
albeit I was like pretty close postpartum, but with twins, but like, so many times I would just leave crying. Like I cannot make these healthcare appointments. Like I just cannot do it. And I think your point about, larger medical systems, which is where people need to go for the record to get super
Yes.
specialized care a lot of the time.
Yeah.
That is the situation I was in. And I do think it tends to be easier in smaller settings.
Mhm.
However, that's not gonna cut it for every person in every medical condition. So yeah,
Absolutely.
yeah.
Absolutely. Yeah. I mean, there's just so many barriers to care. There really is. And it's like, when you really think about it, it's like, it's overwhelming. It's
Hmm.
really overwhelming. And I don't like that, our healthcare system is really reactive. Um, I really want it to be more preventative.
Hmm.
So we don't get to this point where like it's like touch and go and we're really needing to do a lot of like urgent care, for a lot of folks that are like, late 3B4 going on the like teetering on the edge of like dialysis.
Hmm. Yeah, there's so much that we can do. Dietitians specifically, and in
I
general,
know.
but that's beyond the scope of this episode.
Yeah.
For people early in chronic kidney disease, right? Like the earlier that people work with a dietitian or see a nephrologist or have kidney health, as even on their radar, it's
Mhm.
things are gonna go slower. Your outcomes are gonna be better. You're gonna be
Mhm.
less likely to need dialysis or a transplant. Yeah.
Absolutely. I definitely will say, like, another reason why I left dialysis and just try to focus more on CKD is because, that 27, 28, like that is their like quote unquote like birth certificate for dialysis, right? And so
A
it's
GFR
like
of 27 or 28.
no, no, no. I'm talking about your it's a Medicare form called your 2728.
Oh, okay. God,
Yeah.
sorry.
So
Got it. Sorry.
and so
I've never worked in dialysis.
everybody, yeah, yeah. Oh, okay, okay. So anybody that starts dialysis has that form filled out by the nephrologist at the hospital. So
Okay.
it wherever a dialysis patient gets treatment, that form follows them wherever they go.
Oh,
And
okay.
so on that form, there is like a little questionnaire. And so anytime I would see a new patient, I would always look back at that form. And one of the questions is, have you been seen by a dietitian before starting dialysis? And I will tell you, Melanie, I would say 99% of that form was like either blank or it's checked no.
Hmm.
And so when you would talk to well, at least when I talk to my patients, and I talk to them about like, hey, did anyone ever talk to you about meeting with a dietitian prior to dialysis? And they're just like, no, no one ever told me that. Or they'll just say, oh, you just need to watch your salt, or oh, just watch your
Eat
water
less
intake.
protein. Yeah. Yeah.
Yeah, eat less protein. And so like that was like another reason where I'm just like, yes, we definitely want to focus on medical care of CKD, but like we also need to focus on that nutrition care of CKD and early stages of CKD and having
Hmm.
like discussions with the healthcare team, including the dietitian and the social worker, on having referrals sent out for,
Hmm.
to be seen by a kidney dietitian. So like I think that's like another reason why I wanted to shift focus and really have better access to that population so they would either need dialysis or at least prolong starting
Yeah.
dialysis.
Yeah. And it's so amazing that there are so many renal dietitians that are taking that exact same path. Like I can think of
Yeah.
six right off the top of my head, right? That
Yeah.
have worked in dialysis and they're like, this is nutty that I wish I would have worked with this person for 40 years
Yeah.
ago, like, um, and so it's just really cool. Like it's a very cool thing that you're seeing online because unfortunately many nephrology clinics do not have a dietitian. And so a lot of us are saying like, you know what, we're going to do this ourselves and we're starting private
Mhm.
practices, which is so, so cool. We're starting
Yeah.
to make a tiny dent in the massive
Dance.
number of
Yeah.
people that need our help. Yeah. All
For
right.
sure.
So, I feel like we've kind of been doom and gloom up until this point, but kind of moving into what can we do about it? Both from an individual standpoint, like an individual person listening to this podcast versus I think to really make a difference in the situation, we obviously need to see policy changes and things need to change from a federal level as well as like
Mhm.
a healthcare level, all combined. So what would be your top things that we need to do or can do to change this?
Yeah, I think definitely like shifting the focus on like treating underlying conditions, like really making sure folks are on top of like managing high blood pressure, managing diabetes, heart disease, whatever the case may be, to really work on like preventing the progression of CKD.
Hmm.
I think it's also important to really like getting into like labs and having people understand labs and not waiting till the GFR falls below 60 to say something about somebody's CKD, and just being more prevalent. I think definitely something that I am very proud of, at least in the Charleston area, is like one of the larger hospitals that I was affiliated with when I was working in dialysis. They do a lot of outreach. And so partnering with like local facilities, partnering with the local National Kidney
I say
Foundation to like
NKF does so
provide.
much work. Hmm.
Oh my God. And we would do, and I would help them, like we would do a lot of outreach to local churches and setting up free screenings
Hmm.
for CKD. So we would do like urine screenings and then we would have like a doctor, well, like the healthcare team. I would have my little booth of like nutrition stuff, having blood pressure checks, glucose checks, things like that, I think is really, really important. And I think just really getting the word out for people to really understand that kidney disease is like alive and real, and it's nothing to take lightly because I do find that there are some health beliefs with individuals, like especially like, oh, I have a family history of kidney disease, and I heard like my uncle was on dialysis, and so it's just something that it's just expected for me to be on, so I don't need
Well,
to worry about
understanding
my
that there are
diet.
things we can do to prevent it or control it if you have been diagnosed. Yeah.
Right,
Yeah.
right. And then just starting early. I feel like also it's really important on building like culturally competent providers. And not just like having what do you call it? Like a module that you click on the laptop, right? And then you
Right.
just press start and then you're doing your other thing. And then once it's
Hmm.
over, then you can like take your exam. Like I'm talking about like actually having conversations with like the healthcare team, like in the hospital setting, in dialysis to really see where there is a need to help like shift more awareness of CKD in the local communities.
Hmm.
Definitely pushing like telehealth care. As far as like policy, yeah, you know, I'm a big advocate of like the National Kidney Foundation, the Voices of Kidney Health, definitely advocating for more kidney disease funding, more research, really in those local communities. Also, like through the American Kidney Fund as well.
Hmm. Yeah. Yeah. There's a lot of great like nonprofit organizations doing a lot of things. It sounds like you're really saying that the number one thing we need to do, at least from a CKD perspective, is just like a lot of public health education, right?
Mhm.
I think that there was I wish I should have looked up these stats before I recorded, but some stat like 1 in 3 people in the United States don't know that kidneys make urine or something like that. So
Yeah,
I feel like people know about heart disease. People know what your heart does and that it's important, right?
yeah,
Pe-
yeah,
People don't know necessarily, like we don't think about our kidneys until they don't work or they make stones, right?
right.
So yeah, I feel like just kind of education around kidneys in general and also that CKD thing and just more awareness. And I think a lot of work has to
Mhm.
be done, honestly, with primary care physicians, because there's the stat that NKF uses all the time that 90% of people with chronic kidney disease don't even know that they have it, which is astonishing. And even for
Mhm.
advanced CKD, like four or more, it's something like 60% don't know that they have it. Don't quote me on that one, but
Yeah,
it's a astonishingly high number. And I think it's because chronic kidney disease, the progression of CKD is really the result of uncontrolled diabetes and hypertension, right?
yeah,
Like that's for most people, that's kind of what it
yeah,
comes down to. And when you
yeah,
aren't utilizing the healthcare system to the best of its ability for all of the reasons that we've talked about before, that has to be a big reason why we see that progression, the four times higher progression
yeah,
to end-stage kidney disease in people who are African American versus people who are Caucasian, you know?
yeah,
Yeah. Yeah. So
definitely,
so many things. So public education, uh, such a big topic. We could do a whole series. We should have done a whole series.
for sure.
But yes, public education, and just making sure, like for you, the listener to the podcast, um, really making sure you know your numbers and making sure you know your,
Absolutely.
um, do you have chronic kidney disease? And I think that might be especially relevant for people who are listening to this because many people have kidney stones, but maybe don't have a diagnosis of chronic kidney disease. But having stones does increase your risk of CKD. And so
Yeah.
having that scary conversation with your doctor,
Mhm.
facing it, and just to know, like,
Yeah.
because if you do, they're just like stones. There are things that we can do to prevent stones, and a lot of the same things are going to go hand in hand with slowing that progression of CKD if you do have it.
Most
Yeah.
definitely. Yeah, for sure.
Okay. What else can we do to help this?
I think,
Any other?
I know there's so many.
So many things.
I mean, really just having like supportive healthcare systems, and it's like, I think, again, going back on my experience working with like an outpatient dialysis clinic and partnering with the local hospital in the area, having like outreach, having somebody within dialysis and having somebody within like MUSC, and then, you know, knowing and we're aware of like the high prevalence of like CKD diagnosis and like what we could do to really help like spread awareness and really
Mhm,
help slow down that um just that progression, or at least that shock of like, oh my God, I didn't know I had like CKD. I think it's so important. Like it's just important to have a really good multidisciplinary team. Like that includes your dietitian and social workers. So social workers are great. They can get access to resources for folks that, are struggling to, financially or needing access to like better quality food, just
mhm,
really having those conversations and really, doing as much outreach as we can.
mhm. Yeah. Yeah. Education and helping people is always
Mhm.
the answer, right?
It's always right. It doesn't, it's easier said than done, right?
Yes. Yeah.
But I mean, it's a start. It's a start.
Hmm.
And just like, I feel like it's just, I mean, you're passionate about preventing, kidney stones, and I'm passionate about like, doing what I can to help you like slow down the spread of like CKD. And I just wish there were like more people out there that really
Hmm.
could have that passion to really help like that preventative side really hone in and like dial down on
Yeah.
their health.
Yeah, that's one of the reasons I'm so excited to see so many dietitians like us popping up on Instagram because I feel like social media, when done right, obviously there's a dark side of social media, but
Oh
a
yeah.
big one. But a good side of it is it's a platform for people like you and I to be out there to educate people, right? Even if someone doesn't choose to work with us, that's fine, but we still are able to educate thousands of people every single day, and that is pretty cool.
Oh yeah. Oh my God. Like that, and that's what I wanted to do. Like I just wanted to serve, and I just wanted to have people have like the right information,
Mhm,
to really help them take the tools to implement and work on their own.
mhm,
And like if needing more support, then yeah, like reach out to that dietitian to get that support. But because, it's just not there. So, but I'm very happy that there's more of us out there that
mhm.
are doing
Yeah.
doing the hard work.
Yeah, I know. So many of my friends, when when you're talking about what you do, and tell them what I do, and they're like, "Oh, like, is it like competition? Like, are you?" And I'm like, "Not really. Like, technically, sort of, but there are literally millions of people that need our help,
Absolutely.
and the few hundred kidney dietitians that are out there,
Yeah.
you know, people need us, and
Yeah.
we just want to be there so we can help people, help give them hope and help them just know what they can do to delay to improve their kidney health in general, right? Because there are
Yeah.
so many things.
Oh my God. So many things. Yeah.
Yeah.
There's
Yeah.
so many things you could do.
All right, any last thoughts before we close this episode?
Um, I think it's a good conversation to have. Like I don't feel heavy having these conversations. In my family, we talk about hard things. We do hard things.
Hmm.
So I think it's these conversations need to be had. So I mean, I'm glad that, we had this conversation. And I just think just moving forward, just having more awareness out
Hmm.
there is what it's really gonna help kind of turn the needle a little bit.
Yeah. Yeah, absolutely. So, where can people reach you if they want to connect with you, Vanessa? Where can they find you?
So I live on Instagram. IG is my jam. So my handle is at grainandgreen.kidneys. That's where you can find me. I have plans and intentions on having like a free Facebook group. I am not in that brain space yet to do that, but I am also on TikTok. So, and I have the same handle at grainandgreen.kidneys. That's where you can find me. I am more active on Instagram. So if you're listening and you have questions, just definitely pop in. My DMs are always open. And then I'm happy to like have a little discussion that way.
Yeah. And how do you help people? Do you work with people one-on-one? Do you take insurance?
Good question. Yes, I do a lot of one-on-one support, and I have various ways for people to work with me. I definitely try to be accessible with and open to people's goals, levels of support, and budget. But I do one-on-one coaching, and if people just want to like a little taste of what I do as far as coaching, I do offer like single session nutrition intensives. And so for anybody that's listening. And let's say they pop in like on Instagram and send me a DM like, hey, I listened to Melanie's podcast and I'm kind of interested. Then I would like have like maybe like a little special incentive or a discount if you wanted to do a single session nutrition intensive. But I also I have a group program that I launch a couple of times a year. And then I also have like a self-study course that gives like the it really focuses on like nourishing and eating the right foods to support kidney health instead of telling people to stay away from these foods. Like that's not my jam.
Yeah.
And then I also have like just some like low ticket like master classes on just little things that people can do to implement right away to start seeing some improvements in their overall kidney health.
Wow, lots of resources,
Lots.
lots of different ways to learn from Vanessa, which is amazing. And I will link to all of those things that she just mentioned in the show notes so you can easily find her. Um, and with that, I'll close this episode of the Eat Away Kidney Stones podcast. Thank you, Vanessa, so much for taking time. It was a pleasure.
Thank you for having me. I appreciate it very much.
Yeah. Thank you for listening to today's episode. For more help with kidney stones, check out my website, www.thekidneydietitian.org. For more personalized help from me, check out my online course, Kidney Stone Nutrition School. VIP enrollment includes help directly from me. I can't wait to see you there and help you prevent kidney stones. Have a great day.